Good morning, everybody, once again, and thank you so much for joining. I'm Michele Grand, licensed massage therapist. I work with the patients at Smilo Cancer Hospital, and it's my honor and privilege to be with you here today. We're going to take about 30 minutes or so, and we're going to work on some breathing exercises, and we're going to do some soft tissue and muscle release work. The goal of today's session is to help us reduce anxiety. We all experience anxiety for a variety of reasons. During COVID, we're experiencing anxiety on a different level, but these exercises and this soft tissue release is something that would be healthy for us to do every day as we just go through our normal existence. So what is anxiety? Anxiety is our body's response to stress. It can cause physical symptoms such as stomach and digestive trouble, headaches, insomnia, fatigue, shortness of breath, and muscle tension. So today, what we're going to focus on is being aware and in control of our breath, and then practicing ways to release our soft tissue and our muscular tension. As we develop a practice of breath awareness, there's a lot of benefits that we'll experience. It helps to boost immunity. It can increase our confidence in our self-image. It can help to enrich our creativity, improve our personal and professional relationships, and it just aids in an overall improved focus and sense of relaxation. To begin, we're going to do a diaphragmatic breathing exercise, also known as belly breathing. So if you're not already in a comfortable position, just bring yourself into a position that feels relaxed for you. Could be sitting in a chair with your feet on the floor and your back erect, or you could lay down flat on the floor and do the belly breath as well. To begin, place one hand on your upper chest and one hand below your rib cage, so that as you breathe, your hand below your rib cage can feel the movement of your diaphragm. Just take a moment to get comfortable with that position. Just see what it feels like as you slowly press your hand into your stomach area. Now slowly inhale through your nose and feel your stomach pressing into your hand. Keep your upper hand as still as possible. Now you're going to exhale using pursed lips as you tighten your stomach muscles and your upper hand stays still. So the process is breathe in through your nose, feel your belly expand, and exhale through pursed lips, feeling your belly contract. Inhale, exhale. Inhale, exhale. Just continue that pattern, just developing a relaxed state of breath. Inhale through your nose. Exhale through pursed lips through your mouth. The upper hand stays still, and the lower hand feels the belly expand and contract. We're going to take a moment now, release your upper hand, maintain a hand below your rib cage on your belly, and just alternate now between normal and deep breaths. Just notice any difference when you alternate just between your normal breath and a deep breath. Just notice how the shallow breathing compares to the deep breathing. And just now practice deep breaths for a minute or so. Now, as you exhale, let out a sigh with each exhalation. Breath in through the nose. A deep sigh as you exhale. Again, feel how the belly rises with each inhale and falls with each exhale. We're going to begin to think of phrases such as peace or let go or relax. And as you inhale, you're going to bring in waves of peace and calm through your body, and you're going to mentally say, inhaling peace and calm. Breathe in and mentally think, inhaling peace and calm. And as you exhale, think of washing away tension and anxiety. So you'll say to yourself as you exhale, exhale tension and anxiety. Breathing in peace and calm. And exhaling tension and anxiety. Breathing in peace and calm. Exhaling tension and anxiety. Breathing in peace and calm. Exhaling tension and anxiety. Just continue that for several more breaths and just notice how relaxed you're starting to feel. You can almost feel the oxygen flowing through your body, entering all the way up to your head and down to your feet. Inhaling peace and calm. Exhaling tension and anxiety. Let's take 3 more breaths like that. One more. Excellent. Very, very good work. You could just release your hands now to just a relaxed and comfortable position. Just for a moment, you could just have them hanging at your side and just letting it go. Just make sure your back now is relaxed. If you're on the floor, just let your spine relax. If you're sitting on a chair, just feel the back of the chair supporting your spine for a moment, feet grounded on the floor. Excellent. So this is how it feels to do a controlled breathing exercise. It's something you can do at any time throughout the day, anywhere from 5 to 15 minutes when you wake up, in the middle of hecticness, before you go to bed. So this is a good time, if you have water nearby, to just grab a sip of water, because we're going to transition now into some soft tissue muscle release. So just take a little bit of water. And it's always good to hydrate too, during breath work and always throughout the day. Excellent. So the goal of self-muscle and soft tissue release is to actually manage that fight or flight response and to elicit the relaxation response within our body. Now, this is something, again, we're going to be doing self-massage today, self-soft tissue release. The benefits of now this muscular release include better sleep, improved circulation, a release of physical tension, pain relief, and a reduction in just the overall symptoms of our anxiety. Something that's important to remember when we do self-massage is the type of pressure that we use. So I'm just going to show you for now on your hand, although when we start, we're going to be going sort of from our shoulders to our feet and then back up to our neck and head. But just to explain on my hands here, the type of pressure we're going to use. We want a release. We don't want to just touch the outside of our skin. That kind of massage feels good maybe if you're going to a spa somewhere and you just want to lay there and just relax. But we're actually doing some therapy on ourselves, and we want to elicit a release of our soft tissue. So again, you want, as we go along today, you want to feel pressure. So you can use your thumb, you can use the tips of your fingers, you can use this part of your fingers here for pressure, and you could even use the palm of your hand for pressure as we go. You do what's comfortable for you, and it also depends on the part of your body. Like our shoulders tend to be really, really tight and tense, so we can use more pressure there. When we get to little sensitive areas, maybe like around our knees, we're going to use a little lighter pressure around the joints. So that's definitely something to keep in mind. Now, the motions we're going to use are going to be a motion of kneading, which is taking the soft tissue and kind of just like a kneading motion around. Technically, that term is called petrissage, but it's a kneading motion of the soft tissue. At the joints, we're going to do what's called circular friction, which is often using the tips of your fingers and just kind of going around the joints. We can easily get in those spots with one finger. And then on the tighter, more rigid areas, you use the pressure that is comfortable for you, using the body part of your hand that's best for you. So when we start on the shoulder in a minute or two, you just use what's comfortable for you. It could be the whole hand, it could be the tips of the finger. Get the pressure going. That's what we want. We want the release. We want to bring blood flow to the area and we want to move the tissue. The other thing you want to keep in mind too is when we work on a tighter area, again, like the shoulders, it takes a little warm up of the tissue. It's going to be real tight and rigid at first. So the analogy would be like a stick of butter. If you have a frozen or very hard refrigerated stick of butter, you're going to have to work a little bit to get it, to cut or to move. If you have left the butter out for a while, it's nice and soft, and you touch the butter, your finger's going to go right through, or you'll be able to cut right through it super easily. So it's the same analogy for our soft tissue. Sometimes it takes a little bit of time to kind of warm it up. So you want to spend some extra time there until you get to the point where you can kind of sink into it a bit. So today we have a limited amount of time, but when you do the soft tissue release at home, just remember to spend an adequate amount of time to release it, to warm it up, and then you can kind of get in there and get the circulation and the blood flow going. Okay, so for today, we're going to start at our shoulders. So we're just going to take our hands, and you can come back as far as you could reach and just bring the tissue forward. Our trapezius muscle comes up and it actually crosses over the top of our shoulder. So that's why it's a strong muscle. It covers much of the back, and it takes some effort and some controlled massage to get that to release. You may want to take the tips of your fingers again and do a little bit of that petrissage and reach back as far as you can. The more of that muscle you can activate, the better it will be for you. And you could see that the tissue starts to become a little bit red. So that's showing that you're getting some blood flow going, and that's exactly the intention that you want. Another movement we could do at the shoulders is like a pulling motion down. From the top of your shoulder down towards the joint of your shoulder. And just get that release going. It's nice to use the tips of your fingers here. Just really press in. You want to feel the muscle almost moving a little bit. You want to feel the soft tissue moving. When we do one side, we always want to move to the other side. We want our body to be in balance. So we're going to move over to the side that you have not yet done. And we're going to do that same sort of movement, bringing your tissue forward as much as you can from the back to your front, using your whole hand, pressing in with your fingers and bringing it forward. Breath is important as we do this, as your body starts to circulate, as you can feel the blood flow kind of moving. You're going to feel almost like a need to take a deep breath. So go ahead and do that. Listen to your body and continue your breath. Bring that tissue forward. You could feel it. You feel little pops and little movement of the tissue. And never be afraid to work on yourself. And again, we're going to take that movement from the top of the neck down towards the shoulder joint. Again, this is a strong muscle, so you could use whatever part of the hand that you want, the whole hand, all the fingers, to move that tissue. And little circles, again, the petrissage with the tips of your fingers, the kneading motion as far back as you could reach, even up towards your neck a little bit. Make that kneading motion. You could really feel beautiful release. Excellent. Good. So that's how we can engage and activate and release the tension in our shoulders. And as you do this on your own, use as much time as you need. Today we want to move through different parts of the body, so we're gonna keep it going here now, and we're gonna move to the clavicle or the shoulder or the collarbone here. Now the clavicle can get contracted with little trigger points, and we don't even realize it. If you're the type of person that holds your breath in when you're tense, you hold it in, you're contracting all of these muscles here, and sometimes we're not aware of that. So you just take a moment here, and again, this is a sensitive area, so we don't want to use too much pressure. With the tips of our fingers is usually adequate. So start here at the sternum and just make little circles underneath the bone. You don't want to go on the bone, but right under the collarbone, out towards the joint of your shoulder. Little circles, and press in. Again, you want to feel that release. You do want to feel, it's going to be a little tender, a little sensitive, but we're activating the soft tissue. And now right above the collarbone, again, not on the collarbone, but right above it, tender here. So just be very gentle with yourself. The tip of your finger is probably all you need. Just press in. Just feel the release as you press in. Even just holding here is enough to create a release. Just press and hold and breathe. Just very gently move along. Just above the collarbone and just out towards your shoulder joint. Excellent. Just continue the breath. When you get to the shoulder too, we can practice a little bit of that circular friction at the joints. So right at the shoulder bone, you could take a finger or two and you could actually feel the bones and the muscle at the joint. And just slowly work around it, pressing in with a couple of fingers, just to create a little bit of friction, circulation, and release. And again, we want to do that on both sides. Circular friction, couple of fingers just around the joints. And this could be done at any joint. This could be done at your wrists. This can be done at your knees, your ankles. Just a little bit of circular friction. Sometimes on the front here, you feel a little extra something, or on you, it could be on the back. And just take a few extra minutes there when you feel like a little tenderness, a little muscular discomfort. Spend a little bit more time on those spots. Good, excellent. Again, take a deep breath. We want to be aware. We want to be aware of our body, aware of how we're feeling, aware of our breath. Okay, so now we're going to move to the forearms. Now the forearms, again, this is another area that does get tight. It gets tight, it gets contracted, but sometimes we're not aware of it until we actually feel it and press on there. So in this area, these are strong muscles. So we could do a little petrissage here, that kneading motion, pressing in and around, pressing in and around. We can do some deep pressure work and glide up. Sometimes you use the edge of your finger, press down into the soft tissue and up. And just move around. You could actually sometimes even feel the tendons move a little bit, which is good. And as you activate and release the soft tissue, you'll feel a tendency to take a deep breath as we did at the shoulders, and you wanna do that as well. Okay, on the inside of your arm here, the same. You wanna just move that tissue. Our movements we wanna do towards the heart. So rather than going down to the wrist, we wanna go up, upwards motion. So it's up around towards the heart. So we're activating our circulatory system here. Good. And interesting how the forearm can give you a surprisingly good release. Because again, so like we don't say, oh, I have a sore forearm. We don't often feel like that, but we do. It gets tight. We use our arms quite a bit. So this is a good part of the body to do a conscious effort to release. So again, move to your other arm. So we create a balance, moving the soft tissue and continuing the breath. Could be petrissage, kneading motion with your hand. Or it could be that deeper work where we take the ridge of our finger and push in and push up for release. Good. And again, to the inside. Continue your breath. Excellent. Excellent. Good work. And again, we have a joint here at the elbow. So circular friction at any joint is always helpful and useful. And that's where we can just kind of use one finger and don't be afraid to feel what's going on under the skin, because you could feel it. You could feel your bones, you could feel your tendons, you could feel the soft tissue. So just a little bit of joint release on the elbow. Excellent. So now we're going to move on to the legs and the feet for the lower body. So I'm going to try to adjust my screen so this is effective for you. Let me just step back a bit. Okay. So oftentimes our shins get very, very tight and very tense. So this is a wonderful area. Again, we're going to work upwards. We're going to work from the ankle up towards our knee. So just take the tips of your fingers and really press in there. Press in. You don't want to be on the bone. You could obviously feel the bone here, and you could feel a bone here, but around the bone is all the soft tissue. There's tendons, there's muscle, there's fascia, and we want to move it to just get the circulation going, get the blood flow moving. So here, our legs are pretty tough. You could even use the flat part here of your fingers, and you can press in and up. Press in and up, and just feel the release of the soft tissue. You're gonna again wanna continue, be conscious of your breath. You're gonna wanna take deep breaths, and please go ahead and do that. At the knee, again, we could do our circular friction around the knee with the tips of our fingers. And then right here, on both sides of the bone, it could get very, very tender. So with the tips of your fingers, just put little circles pressing up and in. You may feel bumpy, little bumps in there, little adhesions in there. Just go ahead and release them. And as you do this work on your own in the days to come, spend extra time. Like when you feel a little adhesion, a little bumpy spot there, just spend a few extra minutes. If it's super tender, lighten your pressure. Sometimes all you need is to hold the area, just to hold it for release. Excellent. So keeping our balance, we want to move to the other leg and do the same sort of release. Take the inner part of your fingers and just give a good press up and around. Just feel the release. Excellent. Excellent. Continue the controlled breathing. Excellent. And again, we can do little circles on both sides of the bone there. Good. And a release around the joints of the knee. Just think about what you're feeling. You feel the bone. You feel the tendons. The tendons attach the muscle to the bone. The ligaments attach the bone to the bone. Good. And up and around. Beautiful. Very, very good work. This is, a conscious effort that you're making. And I thank you so much for taking the time to learn this and to do this and to improve your health. We're going to end our soft tissue release with work around the neck and the jaw. So you may want to take another sip of water if you have. So we hold quite a bit of tension in our neck and our jaw. Sometimes when we sleep, of course, we sometimes grind our teeth, or throughout the day, if something is causing us anxiety, we don't want to yell or scream about it. So we kind of hold it in and we don't even realize it. We stay quiet, but our body is feeling the effects. So this is an important release for you. Okay, so what we're going to do today is we're going to take, to start, the tips of our fingers and right at the base of your ear on both sides, right here, just gently press in and start to make circles. Now your circles could get bigger. Little by little, those circles could expand until you're activating your jaw muscle. You could start to use the tips of all your fingers now and press in. You could open your mouth, and the more you press in, all of a sudden you're you're gonna feel it. You're gonna feel that tight muscle there. And you wanna try to release it. Now you can use your pointer finger, your whole finger. Open your mouth a little and press in. And you can really feel what's going on in there. As you do so, drop your shoulders and just maintain your breath. Excellent. And just keep that going, pressing up and around. Beautiful. We're going to continue up here because this is the temporal mandibular area. So we worked on the mandible, and now we're going to go up here to the temple area where this muscle gets very tight, but we do want to be tender with it here. You don't want to press too hard. It's nice to use your thumbs and just make circles. Go up from the top of your ear and move with little circles. Feel your shoulders drop. Excellent. And you could take the tips of your fingers come around the tops of your eyebrows, center of your eyebrow, little circles with your finger, move up your forehead, right here to the tip of your scalp. And we're going to press out with the tips of the fingers, press and stretch the tissue. And breathe as you press out, working your way down. When you get to the temples, now you could go back to the little circles for release. And one more right at the top of your eyebrows. Excellent. And to close our soft tissue release, take the tips of your fingers and just give yourself a nice little scalp release. Almost like somebody at the salon is showering your hair and they're giving you a nice extra little scalp massage. Beautiful. At the very tip of your head, press in with your finger and move across the top of your skull. Sometimes it's tender there. And just give it a nice release. You can use the tips of all your fingers. This is the crown of your head. It's very, very significant. Sometimes the crown of our head is closed, and this helps to open it up. Okay, beautiful. Thank you all so much. I hope that was helpful for you. Learning the benefits of controlled breathing, an awareness of our breath, and how to do our own soft tissue release. These are exercises, again, that you can do every day throughout the day on your own for improved health, for a positive outlook. Always continue, obviously, with hydration, lots of water, healthy foods. Be gentle and patient with yourself. And just always remember that our progress is counted in moments. So many things are just moments. Something amazing can happen, and it's just a moment in time, but it can give us a lifetime of happiness, that moment. So just treasure the moments. When something awesome happens, embrace it, acknowledge it, and just let it become part of you. Okay, so again, thank you all for joining. It was my privilege and honor to be with you. I wish you health, and I wish you happiness. I wish you peace, and I look forward to working with you again soon, maybe on some guided meditation. Okay, take care and be well.